Hello, doctor.
How are you feeling today?
I'm better than I was. I'm okay to talk if that's what you mean.
Well, yes, I suppose that is what I mean. It would be good to have a talk if you're able to.
I'm willing to talk. What would you like to discuss?
I'd like to discuss with you your ongoing treatment if things don't go as well as we hope in the future.
I understand, doctor. What are the options?
Well, before we talk about that, can I just understand what's been happening to you at home and how you've been getting on?
At home, it's been quite difficult. I've been very breathless with just about any activity. Even getting to the toilet is a real struggle for me. I'm trying to manage on my own, but it's getting harder every day.
Oh, I'm sorry to hear that. That does sound very frustrating.
Thanks, doctor. It's really hard.
Do you have anyone to help you at home?
Yes, my son Simon visits regularly, but I try to manage on my own as much as possible.
Okay, can we just stop there and can I ask you to give me some feedback on our conversation so far?
Doctor, I appreciate you taking the time to ask about my situation at home and showing concern for how I've been managing. It makes me feel respected and that my thoughts and feelings are important in this discussion. Your approach is helping me to open up more about my concerns and preferences regarding treatment.
Hello, Dr. Green. Thank you for taking the time to speak with me. How is my mum doing?
Well, Mark, I'm afraid she's actually deeply unconscious at the moment and has been unconscious since she arrived here.
Do you know what caused her to become unconscious?
Yes, when she got here, we did a scan as soon as she arrived and it shows that she's had a very large stroke.
That's very concerning to hear, Doctor. What are the implications of such a large stroke for her recovery and quality of life?
I think it's a very grave thing to have happened, and I'm worried that it will have a severe impact on her.
I appreciate your honesty, Doctor. Given the severity of the stroke, what steps can we take next to ensure she receives the best possible care?
Well, Mark, what I'd like to do before we talk about what we might do is to try and understand something about how she was before all this happened.
Before this happened, my mum was already struggling quite a bit. She had been deteriorating over the last 2 years and wasn't managing to look after herself well, despite having some services in place. She needed a wheeled walker to move around because she struggled with walking, which was a big change from 12 months ago.
Rajiv, I'm Dr. Smith, one of the doctors looking after you in the hospital here. I wonder if it would be all right if I talk to you about what we should do in the future if you come in even more sick than you were this time.
Yes. Well, if that happened, I'd certainly want you to try. I'd have to deal with it.
I'm afraid this disease is a difficult disease and we're trying to hold it up and to manage it as best we can.
I understand, doctor. It's just hard to accept that there might not be a straightforward fix.
Are you happy for me to continue?
Yes, doctor, please continue.
And you're now on some treatment that is quite powerful and we're hopeful that it'll help your condition and give you more time.
I'm really hoping this new treatment works, doctor. It's been tough.
Yeah. We're hopeful too, Rajiv.
Thank you, doctor. That means a lot to me.
But also, the treatment does have some nasty side effects, and we've already seen some of those with you coming in this time.
When communicating bad news, it's very common for inexperienced communicators to use a lot of words, a lot of facts, and a lot of jargon, so unintelligible facts, things that people can't understand. The message is actually confused by a lot of words, and it's much better to use fewer words and more emotional words to communicate what you're trying to say. It's often better to say something like, "I'm sorry, I don't think he's going to be able to get over this." Or, "I think this time it's too overwhelming." Rather than lots and lots of words that really just obscure the message rather than succinctly conveying what you're trying to communicate.
So we've reached the point where some decisions have to be made. They're not easy decisions, but they are decisions that have to be made sooner rather than later. There are two main treatment options. The first option is that we do everything we can to prolong life.
Okay.
That has its risks and its benefits. The other option is we move to a more comfort-based care, and that again has its risks and its benefits.
Okay.
It's important that you know that this decision, it's personal more than medical. And it's important that we make the right choice for you and for how you.
I haven't got any options, have I? That is, for me, just terrible news.
Oh, look, it's really hard. It's really hard to say for sure. You can never really predict these things, after all. It's really hard, but, we're really worried, and, you've got the heart problems and the lung problems, and It's a big risk, but we can never know for sure. It's just too hard to tell.
I haven't got any options, have I? That is, for me, just terrible news.
Yeah, I'm really sorry, but I think you're right. I'm really sorry.
I haven't got any options, have I? That is, for me, just terrible news.
I'm so sorry.